CNA Electrical Cord Safety Check. Welcome to the quiz. Question 1. When a resident is on aspiration precautions, which of the following food and liquid textures would be safest for them? Option A. Nectar or honey-thick liquids and moist, ground or soft foods that form a cohesive bolus, like mashed potatoes, pudding, or minced meat with gravy. These are easier to control and swallow. Option B. A whole steak with a glass of champagne, as long as they are sitting upright. Option C. Thin liquids like water and juice, and solid foods like steak and bread. Option D. Foods that easily crumble, like dry cake, crackers, or cookies. The answer is A. Thickened liquids and cohesive foods are safer for residents with dysphagia. Option A is correct because thickened liquids and moist, cohesive foods are easier to control and less likely to be aspirated. Option B is incorrect because steak is hard to chew and champagne is a thin liquid. Option C is incorrect because thin liquids and dry solids are high risk. Option D is incorrect because crumbly foods can fragment and cause choking. Question 2. The purpose of a waist restraint or belt restraint is to: Option A. Prevent a resident from falling out of a chair or wheelchair. It must only be used with a doctor's written order, released every 2 hours for range of motion and toileting, and checked frequently for skin integrity and circulation. Option B. Punish a resident for trying to get out of bed or for being disruptive. Option C. Help a resident maintain good posture while sitting in a wheelchair. Option D. Keep a resident confined to a chair for the staff's convenience so they don't wander. The answer is A. Restraints are only used to prevent injury with strict protocols. Option A is correct because restraints are only used to prevent injury when other measures fail and they require strict protocols. Option B is incorrect because restraints are never for punishment. Option C is incorrect because posture is not the purpose. Option D is incorrect because restraints are never for staff convenience. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A resident asks you to go to the bank and cash their Social Security check for them. What is the correct response? Option A. Explain that you are not allowed to handle a resident's money or personal finances. This is against facility policy and could be considered financial abuse or exploitation. Offer to notify the social worker or business office who can assist them with their financial needs. Option B. Take the check and give it to the nurse to handle, as the nurse can make better decisions about these matters. Option C. Agree to do it as a personal favor to help them out, as they seem trustworthy. Option D. Tell them you'll do it on your lunch break and bring them the cash. The answer is A. Handling a resident's money is a boundary violation and could be considered financial abuse. Option A is correct because handling a resident's money is a boundary violation and can lead to accusations of financial abuse. Option B is incorrect because giving it to the nurse also involves handling and is not appropriate. Option C is incorrect because it involves handling money. Option D is incorrect because it involves handling money. Question 4. You are caring for a resident with a C. diff infection. What is the most important infection control measure you must take? Option A. Wear a mask at all times when in the room, as C. diff is airborne. Option B. Ensure the resident wears a mask when leaving the room to go to activities. Option C. Perform hand hygiene with soap and water when leaving the room, as alcohol-based hand rubs are not effective against C. diff spores. Also, wear a gown and gloves as per contact precautions. Option D. Wear a gown and gloves, which is standard for all contact precautions, and that is sufficient. The answer is C. Hand washing with soap and water is essential for C. diff because alcohol does not kill spores. Option A is incorrect because C. diff is not airborne. Option B is incorrect because the resident does not need a mask, it's contact precautions. Option C is correct because diff spores are resistant to alcohol, so hand washing with soap and water is essential. Option D is incorrect because it omits the crucial hand hygiene step. Question 5. A resident with dementia repeatedly asks, "When is my daughter coming to visit?" even though the daughter visited 10 minutes ago. What is the best way to respond? Option A. Take their hand and say, "You must really love your daughter. It sounds like you're looking forward to seeing her. Tell me about her. What's your favorite thing to do together?" This validates the feeling behind the question and redirects to a positive memory without causing distress over the forgotten visit. Option B. She's not coming today. You need to stop asking the same question. Being firm. Option C. Ignore the question, as answering it will only lead to more repetition. Option D. She just left 10 minutes ago. Don't you remember? She'll be back tomorrow. Focusing on reality. The answer is A. Validating the emotion and redirecting is more therapeutic than reality orientation. Option A is correct because it validates the emotion and redirects to a positive memory, which is more therapeutic than reality orientation that can cause distress. Option B is incorrect because it's harsh and dismissive. Option C is incorrect because ignoring is not therapeutic. Option D is incorrect because reminding them of the forgotten visit may upset them. Question 6. What does the acronym PASS stand for in relation to using a fire extinguisher? Option A. Prepare, Activate, Suppress Survey. Option B. Pull the pin, aim at the base of the fire, squeeze the handle, sweep from side to side. Option C. Press, aim, squeeze, stop. Option D. Point, aim, shoot, spray. The answer is B. PASS is the standard mnemonic for fire extinguisher use. Option A is made up. Option B is correct and is the standard mnemonic for using a fire extinguisher. Option C is made up. Option D is made up. Great job! Don't forget to subscribe. Bye!